Hello, everyone. My name is Jacqueline. I'm going to be talking about HIV. That's the microbe I did choose. It is a virus, and it is a T cell lymphotic virus, and it was later changed to human immunodeficiency virus known as HIV. HIV continues to be a major global public health issue, having claimed millions of lives. It can easily be transmitted by sharing needles, having unprotected sex with someone, and it just being contracted with someone that has the virus. You can get it. So just stay safe out there. HIV is bacterium in adult. Its infected patients is caused by gram-negative bacilli in both community-acquired and healthcare settings. The symptoms are fever, chills, rash, night sweats, muscle aches, sore throat, fatigue. HIV belongs to a class of viruses known as retroviruses. Retroviruses use RNA to encode their genetic information rather than DNA as human cells do. The history of HIV, it shows that HIV infection in humans came from a type of chimpanzee in Central Africa, and it jumped to humans back in the late 1800s. The chimpanzee version of the virus is called simian immunodeficiency virus. AIDS was first recognized in patients in the USA in 1981. But there is different groups of names for HIV. There's group N and O, which are rare and largely restricted to Cameroon and surrounding countries. Then there's group M. There's HIV infections are caused by this group worldwide. The disease is spread by having unprotected sex with someone that has HIV, and also by unprotected sex, anal, vaginal, and sharing a needle syringes. Also, a pregnant woman who has HIV can spread it through her breast milk by breastfeeding. Vaginal fluids, also rectal fluids, and semen fluids. Globally, 38.4 million people were living with HIV at the end of 2021. It was estimated adults 15 through the ages of 49 worldwide are living with HIV, although the burden of the epidemic continued to vary considerably between the countries and regions. The diagnosis of disease and severity it gets diagnosed by blood tests. That's the most common way. And the tests look for antibodies to the virus that the body create and attempt to fight the virus. The three stages of HIV are first acute HIV infection, second chronic HIV infection, and third acquired immunodeficiency syndrome, which is AIDS. There's no cure for HIV, but treatment with HIV medicines called antiviral therapy or ART can slow or prevent HIV from advancing from one stage to the next. It is important to be aware of this virus. The reason we care so much about this microbe today is because there's no cure to it, and many lives are being lost and harmed due to this microbe because there's no cure, but there's treatment. So someone that has it can go on to live their normal lives by just taking medicine their whole life. There's still some confusion about HIV and AIDS today. AIDS is the late stage of HIV, and this happens when the body's immune system is badly damaged because of the virus. In the US, this does not happen because taking HIV medicine as prescribed stops the progression of HIV. The articles I did choose are the projection of age of individuals living with HIV and time since ART initiation in 2030, estimates for France. And then I also chose the burden of hepatitis B, hepatitis C, and human immunodeficiency virus in ovarian cancer patients in Nairobi, Kenya. ART is antiviral therapy. Since the beginning of ART, many people who have HIV have lived longer lives. So, yeah, ART has saved so many lives with people that have HIV. The only problem is that you're going to have to do this treatment for the rest of your life if you do have HIV. And then ART has saved so many lives with people that have HIV. Here's a little chart I found, and you could see how in 1990 there was many deaths, and then around the 2000s when ART did come out, you could see how deaths averted due to ART. So it has saved a lot of lives, and we could see that. And then the other article that I did choose was testing for hepatitis B, C, and HIV in ovarian cancer patients. And I chose this article because my aunt just passed away due to ovarian cancer. And I was reading about it because it did catch my attention how in Kenya today they are testing patients who have ovarian cancer for Hep B and hepatitis C, but not for HIV. All these people today are receiving wrong treatment because the testing of a positive HIV person is not being taken into consideration. And hepatitis B, hepatitis C, and HIV differences, they're almost similar. So HPV is spread by contact with blood or body fluids of an infected person, the same as HIV. HPV is 50 to 100 times more infectious than HIV. Hepatitis C and HIV are RNA viruses, but hepatitis C is a flaw virus and HIV is a retrovirus. Hepatitis C infects liver and HIV infects human immune cells. And then I also found a chart for this, and it just shows how in Kenya, the HPV positivity, the HIV positivity, HCV positivity, and so on. So we could see like how it rose and then it just keeps going lower just because maybe they started testing for HIV and less deaths are happening. So yeah, thank you guys for hearing my presentation about HIV, and I hope you guys enjoyed. Thank you.